Hi, my name is Danielle DeMeza, and I will be presenting on lean management in the healthcare field. So what is lean? Lean is a set of methodologies and practices that strive to create an environment and system that provides maximum value for the patients involved by reducing the waste and focusing on the patient's needs. Implementing this method can be difficult, but is worth it if done correctly for both the patient and the healthcare facilities and employees. So reasons for lean implementation, high rates of inappropriate care or wasteful care. When the risk of harm in a treatment outweighs the potential benefit, it can rightly be called inappropriate. In the study, the COURAGE trial of cardiovascular medicine, half of all cardiac stenting was identified as clinically inappropriate. According to the National Academy of Medicine, between 35 and 50% of all money spent on care delivery today in the US is technically waste. Whether the waste results from building unusable products, providing unnecessary treatments, or simple inefficiency, it adds no value to the patient's perspective, deeming it waste. Another reason to implement lean management, variations in clinical practices. So standardization in care for every individual patient is still nearly impossible given the variation in access to healthcare. But the Affordable Care Act was designed to increase access to care by attempting to guarantee care to everyone. But in reality, access to care varies across the spectrum, and where a patient goes to receive care could be just as important as whether they have insurance. This implies that healthcare professionals don't necessarily agree on best practices. Implementing lean sets a standard goal that various healthcare professionals are trained in. All of their training is based on the same values. A third reason is unacceptable rates of preventable mishaps. Unacceptable rates of preventable mishaps, care-associated patient injuries and deaths happen in the healthcare system more often than one would like to admit. Research shows 210,000 preventable deaths each year in the US alone. Medical errors are the third leading cause of death in the US. Everyone is human and errors occur, but implementing standard procedures can allow for those errors to be found before becoming fatal. And the fourth reason, an inability to follow standard practice. Anything that is powerful enough to heal can also harm. Healthcare professionals are constantly walking a very thin line between health and harm. There's a strong need to more accurately identify than continuously implement proven methods. The one test the doctor decides not to do could be the one test that finds exactly what is wrong with the patient. But to do every test to every patient just to find that one can be time and cost ineffective. This is what can be difficult to determine, but there should be standardized practices that should be followed. So, implementation strategies of lean. So there are various ways of implementing lean, and some even include Japanese terminology. So the Kaizen or Lean Basics session is a one-day workshop that introduces lean tools and techniques. Then there's the 5S events, which is sort, sweep, simplify, standardize, and sustain/self-discipline. And it represents a set of concepts that help organizations ensure a clean and organized workplace. The Rapid Process Improvement Workshops, or RPIW, is a week-long event, also reported as a 3-day lean event, where teams of patients and their families, staff, and clinicians focus on one problem, identify the root cause, create solutions, and implement the solution in the workplace. Value stream maps in healthcare are a visual tool to understand the flow of patients, supplies, or information to the journey of a patient, and it maps all processes required to deliver a healthcare service. So mistake-proofing projects are there to develop a device or procedure to avoid such an error in the future. So anything that comes up, they basically create a procedure to make sure that never happens again. And Kanban is a visual signaling system when new parts, supplies, or services are needed, in the quantity needed, and at the time they are needed. So the cycle of lean is plan, do, check, and act. So when creating a plan for change, it is important to keep in mind all aspects of those involved. Also, identifying specifically what you want to change is important, and what could potentially be affected directly or indirectly by these changes. And lastly, in planning, define the steps you need to make the change and predict the results of the change. For do, carry out your plan in a trial or test environment on a small scale under controlled conditions to best understand how it will run in real time. This is important because you are able to work out any kinks or issues that may come up that no one had even thought about before it is fully implemented. Check. Examine the results of your trial. Verify that you've improved the process. If you have, consider implementing it on a broader scale. If you haven't improved the process, go back and try again. Act. Implement the changes you verified on a much broader scale. Update the standard operating procedures and use your plan in real time. Slowly but properly implementing it is key for a smooth transition into success. So the basic principles of lean management, focus effectively on providing value to patients. Think about what is best for the patient and how certain changes would greatly affect them, whether that be time, money, or their own health. Respect and engage all people involved. So this pertains to everyone, both patients and employees. In order for the system to work effectively, employees must be engaged just as much as the patient and have the utmost respect for who they are caring for. Improve the system by eliminating maximum waste. So waste in the healthcare field can be described as transportation being too long, too many people involved in the process, people waiting around too much, such as patients for their appointments, or any other defect in the system that would leave the patient unsatisfied with their care, or even defects in the patient that the patient doesn't realize are happening, but doing without could benefit both them and the employee's time. Maintaining a smooth flow. So the system needs to flow smoothly in order to be successful. Times where there are nurses pulled from stations to do the job that someone else may be able to do is taking away from that nurse's time to do her original job, which will then pile up her work and does not create a smoothly running system. These kinks will all be worked out if lean is integrated properly. And lastly, striving for perfection and constant improvement. Although the word perfect seems impossible, it is what you should strive for your company to accomplish if you want a system that works most effectively. Making sure everyone involved is engaged and actually satisfied is what is most important with lean. Being a lean leader. It takes different skills and abilities to achieve this status. Someone who would be a lean leader knows they're not in a boss role, but take more of a hands-on approach. They get right in there with the action to better understand every aspect of the environment they are striving to improve. A lean leader does not just demand, but leads by example and truly wants to see their problem solving follow through. So implementing their leadership. Lean leaders effectively exhibit the following behaviors every day. So they know how the business serves the patient. So they understand what the patient needs, what they want, what they value, knowing how the service can satisfy the patient, and improving the effectiveness of how the service satisfies the patient. They have the ability to help others achieve their full potential. So they guide problem solving. They lead from learning the ins and outs of the system firsthand. They ask open-ended questions, make other people think of solutions as well. Understanding that there's always room for improvement. So they continually challenge status quo, knowing that there's always room for change, and understanding that the patient changes and what delights today could be a necessity tomorrow. They focus on the process and results. They obtain the results, they ensure how the results are achieved in the most effective way they utilized, and improve how the organization accomplishes those results. They create an environment to sustain improvement. So they identify, model, and encourage the lean behaviors. And although they're considered a lean leader, they want everyone to kind of follow through. They find the lessons in every failure, there's no blame, and respecting and improving standards is very important. So some common mistakes in implementing lean management. So first is not devoting enough resources. So hospitals and other healthcare facilities should dedicate a team or at least one person to be fully devoted to lean management in the office. It allows for a better focus on actually getting the agenda up and running a lot smoother and faster with less time fix issues. Leadership is not fully engaging in lean. So people who take on the role of lean leaders need to be devoted in creating a new environment for everyone involved. If this person thinks things are fine the way they are and is not passionate about implementing change, it'll never work. Healthcare facilities need to have people in these leadership positions who want to see their work benefiting people and really strive for perfection, but always being open for improvement. Getting stuck in trials. So, as previously stated, once an idea is implemented to better the system, the company can do a test run to see how effective it could be while simultaneously working out any issues that may arise that they were unaware of. So some places get stuck in these phases with constant problems arising or not being confident enough to put into full production mode. It is best to really think about all the aspects of a plan before um, they implement it and potentially start smaller, implementing lean in bits and pieces, then really creating a bigger plan as you progress. And not standardizing practices. So leaders know there's always room for improvement and that once something is set, there may be a better way to do it that comes up. However, it is still important to standardize one way of doing it so that it is a constant goal to achieve. If a better solution does come along, that becomes a new standard, but realizing there's a bar to set is important to improve. Um, so, basic conclusion, implementing the lean management strategies, even in just parts of the workplace, are only going to provide benefits to everyone involved. It emphasizes the consideration of the patient's needs, as well as total employee involvement and continuous improvement of the plan. It strives for respectful ways of satisfaction among the healthcare system and those who use it. Short term, this may seem costly and time consuming, to have to constantly tweak the process at various levels. However, once a standard is set, it will only create maximum progress from that moment forward. So thank you for listening, and I hope you learned a lot from this video.